So inborn errors of metabolism. So now let's do inborn errors of metabolism. An infant is brought to a hospital because her wet diaper turns black when they are exposed to air. Wet diaper turns black means generally the urine is generally diaper has, okay, look, I'll tell you. This is an indirect question, a clinical question from your biochemistry also. You have done this. So the diaper is turning, the wet diaper is turning black on exposure to air, or after long standing it is turning to black. Almost all of you have diagnosed the case here. Urine turning black on long standing, that is nothing but what? That is generally alkaptonuria. So alkaptonuria, urine turning black on long standing, and this is generally due to the deficiency of physical examination of infant is normal. The disorder is caused by generally a deficiency of homogenetic acid oxidase. So this is generally the case here. This is generally the diagnosis of alkaptonuria, urine turning black on long standing, and this is generally due to the deficiency of homogenetic acid oxidase enzyme. ठीक है, आगे देखो. Next is an 8-year-old child presented with hepatomegaly and hypoglycemia. Hepatomegaly means liver has been enlarged, and there is hypoglycemia means less amount of sugar. Okay, so he was diagnosed with glucose 6 phosphatase deficiency, G6 PD deficiency, G6PD. The cause of hepatomegaly in this child is, so this is G6PD deficiency. This is going towards your generally GSD, glycogen storage type 1, that is 1-GRK. So this is generally 1-GRK. So this, all of this you have completed in your generally. The first thing I did on this channel was biochemistry. The first subject that I covered, the PYQs, was from the biochemistry. So this question again has been covered in the biochemistry. So you can just go to the biochemistry and just cover it once. That will be very beneficial for you. Everything will be revised at one place. So next, see. So this is generally G6PD, that is 1-GRK का diagnosis है. The cause of hepatomegaly in this child, they are asking the cause of hepatomegaly. So that is generally due to the glycogen and fat accumulation in the liver, that will make the liver large. This is glycogen. So glucose तो काट ही दो यहाँ से, ग्लूकोज काट दो. So of course एक ही ऑप्शन में glycogen, so you can go with that. That is also a way to solve this question. Next, burnt sugar smell. So alkaptonuria हमने पढ़ लिया था. Generally urine turning black on the long standing है ना, or exposure to air. Now they are asking the burnt sugar smell of urine in a child, which enzyme deficiency. Look, burnt sugar, first make the diagnosis. So burnt sugar smell is generally the characteristic of maple syrup urine disease, MSUD, maple syrup urine disease. So this is generally branched chain alpha ketoacid dehydrogenase enzyme की generally deficiency से होगा. So this is generally branched chain alpha ketoacid dehydrogenase. A normal born child presents with mental retardation. A normal born child presents with mental retardation, blonde hair and convulsions at 1 year of age. Most probable diagnosis. So look, normal born child, mental retardation is there, blonde hair. So you, from there you can generally make the diagnosis. If blonde hair you are seeing, you are going towards the phenylketonuria. So look, phenylketonuria में generally the clinical manifestations of classic phenylketonuria we'll see here. The affected infant is normal at birth. Of course this infant was also normal at birth. Mental retardation may develop gradually and may not be evident for the first few months. Of course vomiting sometimes severe enough to be misdiagnosed as pyloric stenosis. ठीक है, पाइलोरिक स्टेनोसिस में भी ऑफकोर्स देयर इज वॉमिटिंग, नॉन विलस वॉमिटिंग मे बी एन अर्ली सिम्टम. Older untreated children become hyperactive with purposeless movements, rhythmic rocking, and generally athetosis will also be seen. Infants are lighter in their complexion than unaffected siblings of blonde hair. So I told you now, this blonde hair, this is generally making our diagnosis to what? Phenylketonuria. These children have an unpleasant odor of phenylacetic acid, which has been described as the musty or mousy odor will be there. That was maple syrup urine disease, where you had generally burnt sugar smell. This phenylketonuria will generally have the musty or mousy smell. The most infants are hypertonic with hyperactive deep tendon reflexes, microcephaly, prominent maxilla with widely spaced teeth, enamel hypoplasia, and growth retardation are other common findings in these untreated children. If you not treat the children in the time, then you will have this microcephaly, prominent maxilla with widely spaced teeth, enamel hypoplasia, and growth retardations will be found there. So this is all regarding your generally metabolic disorders or inborn errors of generally metabolism in the child. This is generally nothing but a clinical part of generally the bio.